These are unprecedented times, a time where now more than ever, and quite literally, our own health and safety depends on the health of our neighbors and every single person around us. That's why it's so important that everyone, no matter your immigration status, know that health services are available to you. And because we always have each other's backs, we're going to share some important healthcare facts all immigrant families should know to stay healthy. Because let's be real, many of those on the front lines fighting COVID, our healthcare workers, janitors, store clerks, and so many others are immigrants. I'm Amihan with iAmerica here in California. I'm practicing social distancing with Maria, who's in Maryland, and going to kick it off for us.
Hi from Maryland. Yes, we are practicing our healthy distancing and sheltering in place as we speak. But first and foremost, if you are feeling sick and experiencing coronavirus symptoms, such as the cough, shortness of breath, or a fever, please do seek treatment. You should know that there is no federal, state, or local law that prevents immigrants, including undocumented immigrants, from accessing healthcare treatment. You should also know that there is no law preventing healthcare providers from treating people who are undocumented. Immigrants and their families can seek treatment at community healthcare centers at a low cost or even for free, depending on your income. To find those healthcare centers near you, check out our website at iamerica.org/stay healthy. You should see it on the screen. iamerica.org/stay healthy. Check it out to find a community healthcare center near you.
Thanks, Maria. Another important fact immigrant families must know is that the public charge rule does not apply to the testing, screening, or treatment of communicable diseases like COVID-19. Now, I know there's a lot of confusion around Trump's expanded public charge rule, but on March 14, 2020, USCIS issued an alert encouraging everyone, regardless of immigration status, with symptoms resembling COVID to seek necessary treatment or preventative services. If you're a green card applicant and you're still worried about seeking treatment, the folks at Boundless have a free tool to help assess the risk of denial under the public charge rule. A link to that tool is available at iamerica.org/stay healthy.
And just as important is that immigrants and mixed status families should not forego medical treatment for fear of disclosure of immigration status. Get medical treatment. And here's why. Healthcare providers are not required to ask about your immigration status. In fact, there is a law in place, the HIPAA Act, that prevents your health information from being shared without your consent. We compiled a bunch of information from credible organizations about immigrant rights around healthcare access, but you need to visit our website at iamerica.org/stay healthy. Again, you should see it on the screen, iamerica.org/stay healthy. You'll find helpful links from our partners at NILC and the Protecting Immigrant Families Coalition. Check it out.
And here's one more thing. Immigrants and mixed status families should not avoid going to the doctor for fear of immigration enforcement. Go to the doctor. On March 18, 2020, ICE announced that it would temporarily stop enforcement operations due to the COVID-19 outbreak. They also confirmed that it would follow its sensitive locations policy, meaning that for the time being at least, immigration enforcement will not take place at medical treatment and healthcare facilities such as hospitals, doctors' offices, accredited health clinics, or emergency and urgent care facilities. And CBP also have similar guidance in place to limit enforcement at hospitals, except of course under extraordinary circumstances. But bottom line, ICE and CBP should not be poking around at hospitals and doctors' offices.
And there you have it. We know it's a lot of information, but if you text the word healthy to 802495, again, the word healthy to 802495, you can get this information straight to your phone, and then share it with your friends and family. Right now it's time for us to come together, help each other out, and let's put our differences aside, because that's the only way we're going to get through this together.